COVID Vaccine Equity Task Force. We operate in compliance with the Kansas Open Meetings Act. This meeting is being recorded and live streamed on KDHE's YouTube channel. Please mute yourselves when not speaking to prevent audio interference. So super nice to see everybody, and welcome to anybody who's here for the first time. And of course, welcome to everybody who's attended before. My name is Jimena Garcia, and I'm the Governor's Senior Advisor for Vaccine Equity. I'm going to be leading this discussion today together with Dr. Kali Akers and her team at KUMC and my colleagues from KDHE. So I'm very excited about today's meeting because we have a lot of good information to share. So I'm going to do a quick review of the agenda. So we're going to start with introductions. Then Jamie Gable, Senior Epidemiologist at KDHE, will review the most current COVID vaccine data. After that, Becky Prawl, KDHE Immunization Section Chief, is going to share the information that we have so far about the Bridge Access Program, which is meant to provide free COVID vaccine to uninsured Kansans starting this fall. After we hear about the program, we're going to break into 3 breakout groups, essentially to hear from all of you about what information you think people in the communities that you work with would be interested to know, and also how that messaging can be shared. So let's jump in. If you are attending this meeting for the first time and would like to, please take a moment to introduce yourself and maybe share a few words about something that you're passionate about. And if you're a returning member, please put your name and organization in the chat. Is there anybody new here today that would like to introduce themselves?
I'll introduce myself. So I'm Amber Beck. I'm the Executive Director for Here in Health here in Wichita. And I'm just passionate about helping individuals and advocating.
Thank you. Welcome.
I'm Lisa Knoll. I'm with Genesis Family Health. We are an FQHC in Southwest Kansas with locations in Garden City, Dodge City Liberal, and Ulysses. We serve about 18,000 patients. The majority of our patients are Hispanic. And the majority, I wouldn't say the majority, but probably 40 to 50% don't speak English. We probably have at least 17 to 25 different languages in our communities. And I'm just passionate about helping others and building a stronger Southwest Kansas.
Wonderful. Well, welcome. Thanks for joining us.
Hi, everyone. I'm Lauren Swinson. I am the BDCP director here at KDHE. I took over for Bill Griffin 1 year and I think 8 days ago now. But I have not been able to make it to one of these meetings, although I promise I have been trying. So I'm really excited to be here today, especially because we've got some of my team members presenting. So nice to meet you all. I would say I am passionate about all things infectious disease, which includes immunizations. So thank you guys so much for putting this on and inviting me.
Thank you, Lauren, for being here with you. Okay, well, thank you. And so we'll just jump in and we're going to start with Jamie Gable, Senior Epidemiologist at KDHE, who's going to share with us the most recent COVID vaccine data.
All right, thank you so much for having me again. I will go ahead and wait for my data slide to pop up. So we're going to go ahead and continue to focus on bivalent vaccine uptake in Kansas. As new vaccine versions and schedules are approved, we'll do our best to update the information that we present on these meetings accordingly. So right now we still have the original bivalent that is sort of the focus, but we do still want to keep in mind what 1 dose and completed series look like for the state. So this data is of August 2nd for 1 dose completed series and bivalent booster doses. We just see very small increases across the board, particularly for 1 dose and completed series in some cases. the increase of people isn't even enough to increase any percentage points. But so some numbers might look the same as last month. We do see a little bit of larger increases for the bivalent doses. The 65 plus age group increased by 0.7 percentage points and the tender age by 0.3. Older adults continue to have our highest coverage, which is good because that's our vulnerable population, but tender age, we still have less than 2% coverage for bivalent. So that is not what we'd like to see there, since that's still a vulnerable population and they don't have the protection. Next slide, please. So this slide, we're going to look at bivalent booster uptake across different races and age groups. Native data is updated here to reflect anyone who has indicated Native as one of their races. So they have the highest coverage for all of our age groups. White has the second highest coverage for adults and older adults, and Asian has the highest coverage, second highest coverage for children. The biggest increases in coverage from this month, from last month, are Native for all age groups. Lowest coverage for all age groups is Hawaiian and Pacific Islander Kansans and that's followed by Black Kansans for all age groups, except for older adults, where Asian Kansans have very lower coverage compared to their other age groups. I wanted to do just a quick refresher on what the any race AIAN means. This would indicate that Native is indicated as one of their races in Kansas Web IZ, and there may be other races indicated as well. So they could have Black and Native indicated, and they would be under the AIAN in this slide. I also wanted to do a quick reminder that this is independent of any ethnicity fields. So if somebody is Hispanic or non-Hispanic, they will be recorded as their race on this slide. And then in the next slide, then when we look at ethnicity, if they're Hispanic and Black, they will be considered Black on this slide, and they will be considered as Latino on the next slide. So next slide, please. We're looking at similar information, but now we're looking at ethnicity instead of race. We know from previous meetings that we tend to see higher coverage in Hispanic and Latinos in Kansas for having received at least one dose. We can see here that that is not the case for bivalent booster doses. Increase in Hispanic and Latino coverage from last month were 0.1 for adults and older adults and 0.2% for children. For non-Hispanic Latino, the coverage increased compared to last month at 0.1% for all age groups. So we know we have a little bit of work to do to get Hispanic Latino to catch up with where non-Hispanic Latino vaccination is. And if you're wondering why the total Kansas numbers are sometimes higher than any specific race or ethnicity, we do have a fair number in Kansas Web IZ that don't have that field completed. So it's as an unknown. So that is what I have this month. Happy to answer any questions if there are any. Otherwise, Dr. Garcia can continue with her agenda. Thanks.
Thanks so much, Jamie, for being with us and sharing all that. Does anybody have any questions for Jamie? Okay, let's go to our next part. Okay, so last month, I shared a broad summary about the COVID-19 vaccine bridge program, as well as a little bit about the impact of commercialization of the COVID vaccine. So just to recap briefly, starting this fall, the federal program for distribution of COVID vaccine is ending. So COVID-19 vaccine is becoming an annual vaccine, and it's going to be covered in a similar way to other vaccines. So it's going to be covered at no cost with most private insurance plans, Medicaid and Medicare, and children who are uninsured will be able to get COVID vaccine at no cost through the Vaccine for Children program. So that works for most people, but not for adults without insurance, Medicaid or Medicare, who can't afford to pay for the vaccine. And that's who the bridge program is going to be important for. Unfortunately, we don't have all the details yet, but Becky Prawl is here to share all the details that are available so far, as well as information about the Vaccines for Children program. So I'd like to introduce Becky. Becky is a friend, colleague, and a registered nurse, and the immunization section chief at KDHE, and has been a dedicated vaccine advocate for years and years. And so with that, I'm going to pass the floor to you, Becky, and we have about 15 minutes for this discussion.
Thank you very much. So today I want to share a little bit about the COVID-19 vaccine and some things that you may see coming. I also am going to touch on a few things that Dr. Garcia just talked about as well. So next slide, please. So just as a little bit of history for everyone, through COVID-19 vaccine, you may have heard in the news about the Advisory Committee on Immunization Practices, but I wanted to just touch a little bit about how the immunization schedule is kind of developed. So there's a group of folks that are medical and public health experts. They have a lot of different expertise. And what they do is they come together and they look at vaccine safety data. They look at how effective vaccines are. They look at clinical trials and different studies. And together they develop what we would call the routine immunization schedule. So most of us are familiar with the schedule when it comes to like infants and children, because we know babies get shots and, kids get shots through school, but also there are routine recommended vaccines for adults. Next slide, please. So in October of last year, the ACIP committee came together and they added COVID-19 vaccine as a routine recommended vaccine. So that means everyone 6 months of age and older are recommended to get this vaccine. Next slide, please. So it sounds like Dr. Garcia had talked a little bit about commercialization last month, but in case you're not familiar, I wanted to add just a little bit of information. So as the pandemic ends, COVID vaccine availability is going to go back to what we would have been familiar with pre-pandemic. So during the pandemic response, doses were purchased by and provided by the federal government. And as vaccines become available on the commercial market, as she said, most insurance companies, Medicaid and Medicare, are going to cover those vaccines. There are also the Vaccines for Children program and the Bridge program that will provide COVID vaccines as well. Next slide. So just a little bit about the Vaccines for Children program, if you're not familiar. The Vaccines for Children program is a program where vaccines are covered at no cost to eligible children. So locations that provide this vaccine can charge an administration fee to give the vaccine. But the wonderful thing about the Vaccines for Children program is that children cannot be turned away for the inability to pay that vaccine administration fee. So in the late 80s and early 90s, there was a measles outbreak. And what was found was there were a lot of children who had insurance, but were involved in this outbreak. And what they found was that either insurance companies were not covering vaccines, or that the cost was so prohibitive that parents weren't vaccinating. And so the Vaccines for Children program was launched. So participating providers such as doctors' offices, federally qualified health centers, safety net clinics, health departments, and some other locations that are enrolled would be able to provide this vaccine for folks. So the Vaccines for Children program is through the age of 18, which means children can get vaccinated up until their 19th birthday. And then to be eligible, they would receive Medicaid Title 19 or Title 21. They would have no insurance, be American Indian, Alaskan Native, or what we call underinsured. And what that means is they may have insurance, but for whatever reason, their insurance either has a cap at what they will pay, or for some reason do not cover vaccines. Next slide, please. So very similar to the VFC program, there is a new program that will be launched this fall, most likely next month, and it is called the Bridge Access Program. So this program is a temporary program for the next year, and what is hoped is that this is going to bridge from where the COVID-19 vaccine was available to everyone at no cost, into what we hope to have a Vaccines for Adults program. So as you heard me say with the VFC program, it's through 18 years. So this program will start at 19, and it is for adults who do not have health insurance, or for whatever reason, their insurance will not cover the cost of that vaccine. Next slide, please. So Lauren found this infographic, and I thought it was a really great infographic to share that just has a little bit of information on the Bridge program. And on the next slide, as with the Vaccines for Children program, local health departments, FQHCs, and other locations who are enrolled will be able to provide this vaccine for individuals who are uninsured or underinsured. And then there's also going to be a pharmacy piece where we know right now within Kansas, CVS and Walgreens will be enrolled, but may also have some other pharmacies in the pharmacy piece as well. So I guess just to say for now as a summary, that the COVID-19 vaccine is recommended for everyone 6 months and older. And until this commercialization happens, the COVID-19 vaccine is still available at no charge for anyone who is interested. And that is all I have.
Thank you, Becky. Does anybody have any questions of Becky before we move to the breakout groups? Well, if anybody's thinking of a question, in the meantime, I just want to make a comment, and that's, I mean, I know people on this call might be thinking about this, but to me, like the part about this that's hard for a state like Kansas is that the pharmacy chain piece isn't going to be very useful for accessibility, you know, maybe west of Wichita. And so it's going to, you know, that whole side of the state, we're going to have to figure out how to maybe get other pharmacies to enroll, or just a way to make the vaccine accessible when you're not near a Walgreens or a CVS. All right, well, I might then, if there are no questions, I'm going to pass the floor to Vicki, and she's going to share with us what we're going to do next, about the breakout groups.
All right, good afternoon. Thank you, Dr. Garcia, and thank you, Becky, for that great presentation. As I think we all have learned throughout the pandemic, it is in times of transition where information gets a little more slippery and people have doubts. And we, in this group in particular, have thought a lot about how to create communications that are effective in reaching different groups with emerging information, so that we are being proactive as we move forward. So to that end, we're going to spend the rest of our time, or most of the rest of our time today, in breakout groups, discussing how we might think about specific populations during this time of transition, how we might communicate with those populations, and in particular, what kinds of messages are really important to get out. Much like we did when Paxlovid was emerging, this group spent some time thinking about how do we communicate effectively with different groups. So to that end, my colleagues and I will be facilitating breakout groups that look at questions like, what concerns do we have? What lessons learned do we want to think about as we're thinking through communications? What modes of delivery should be considered? What messages? And then lastly, we'll be soliciting participants that are interested in being parts of work groups to advance these kinds of communications. So here momentarily, our colleague Matt will be opening